Chair thanks the gentleman and now recognizes the ranking member of the full committee, Mr. Waxman, for 5 minutes for an opening statement.
Thank you, Mr. Chairman. Today we have a hearing on the entitlement programs and the economy. There's an implication here that we have to choose one or the other. Unfortunately, in the name of fiscal responsibility and balancing the budget, we're often presented with what I believe is a false choice between securing our nation's fiscal health and ensuring the health of older, disabled, and low-income Americans. There are different paths we can take to ensuring long-term fiscal health of Medicare and Medicaid. The Ryan budget proposal that's going to be on the floor this week, what my Republican colleagues and their witnesses propose in our hearing today, are fundamental structural changes in the programs, which through premium support and privatization for Medicare and block grants for Medicaid don't hold down the cost, but simply shift them to beneficiaries, providers, and states. This path, as I said, doesn't lower costs. It shifts costs in a way that undermines the program's guarantee of access to care. The alternative path that we began in 2010 with passage of the Affordable Care Act is to reform entitlement programs through delivery system reform that improves both efficiency and quality. The Affordable Care Act improves access to preventive care that saves dollars and lives. It includes incentives to reward physicians and other providers for better coordinating care and improving health. It has also included policies to cut waste and inefficient care. Health reform is entitlement reform. It is this kind of reform that builds a better health care system for all Americans. At the same time, it lowers costs and helps support the long-term sustainability of our public health care programs. Medicare and Medicaid aren't ballooning out of control. These programs are amazingly efficient. Over the next 10 years, Medicare per capita costs are expected to grow at 5% per year, as opposed to 6.9% in private insurance. On the Medicaid side, the Congressional Budget Office estimates projected Medicaid spending dropping by $200 billion through 2020, and the CMS actuary predicts spending will grow no faster per beneficiary than private insurance. The problem is the numbers and aging of our society. In the coming years, we'll see a growth in the number of people who need Medicare and Medicaid. For Medicare, it is because of the retirement of the baby boomers, and many of these Medicare beneficiaries will also rely on Medicaid. Currently, dual eligibles are 15% of the Medicaid population, but account for nearly 40% of expenditures. In Medicaid, millions of Americans who were previously shut out of having insurance, particularly the working poor, will now have access to coverage beginning in 2014. More people clearly means more costs, but the solution should not and cannot be simply to shift costs to states and beneficiaries, but to continue our efforts to improve the value we get from our programs in a thoughtful and sensible way. Did we know there was going to be a larger population coming on Medicare and Medicaid? Of course we've known this. We've known that we've had a baby boom population. But rather than put money aside to take care of that population, we spent it on two wars without any funding for them. We spent it on tax breaks for the upper income without paying for them. We worked ourselves into a deep debt, and now the money is not there that we anticipated to use for these programs. Well, the Republican budget slashes away at the programs that families need most. The Republican budget is built on a hoax. On the one hand, they say it balances in 10 years. On the other, they say repeal Obamacare. The fact is they repeal all of the benefits of Obamacare, including improvements to Medicare, like filling in the Medicare Part D donut hole and adding no-cost preventive services. But then they turn around and keep the very Medicare cuts and taxes from the Affordable Care Act that Republicans campaigned against. Revenues need to be on the table. I don't think most Americans will say we know there are going to be 70 million more seniors, and Medicare, we hope you can make do with dollars that supported only half that number. We need to eliminate the tax perks for the wealthiest. It's unjust, especially if at the same time we're talking about cutting holes in the safety net for the elderly and the poor. Yield back my time.
Chair.